Shelley's here. We're going to get started without Shelley. Welcome everyone to the April meeting of the Manhattan Community Board 7 Health and Human Services Committee. First, do we have a motion for the adoption of the agenda?
So moved.
All in favor? Opposed? Okay, the agenda is adopted. First, we're so grateful to have a presentation today from DSS regarding a conversion, a proposed conversion, I should say, of an existing emergency site. So yeah, come on up if you're ready. Wonderful.
Well, come on down.
Come on down, up, whatever.
Which door?
Need a second to try and get this.
So Jenny, if you want to try to,
Just one second.
There we go.
The microphone.
Very good.
Okay,
That's all you gotta do.
perfect. All right, you can see, okay, perfect, because I have to keep moving the screen so I see everyone. Hi, everyone. I'm Jenny Drossman. I'm the Associate Vice President of Street Solutions at Goddard Riverside. I oversee our monument stabilization bed that we're speaking of today, as well as our outreach teams. We have the Uptown Goddard team that serves this lovely area and the east side. We have the downtown team that also serves 23rd Street and below. We also have a Safe Haven in Elmhurst, Queens that I oversee. And then I have a few emergency capacity sites in Queens area. But today we're focusing on the monument. I was here in March of last year talking about opening of the site when it was going to be adult families. And now I'm here to talk about the change to single adults that we are working with. So same group of people, but kind of a little bit of the different services that I'm going to talk about. So really, the goal of our site is to support residents in obtaining and maintaining permanent housing. So we have case managers working on the obtaining portion, and we have our residential staff working on the maintaining portion. So really, when we're focusing on working with folks in stabilization beds, it's to stabilize folks. So never kind of think about how important it is to sleep. If you haven't had a good sleep in 72 hours, what it can kind of do to you, and think about maybe 30+ years of street homelessness and sleeping on park benches. Getting a warm bed to sleep in that's safe and away from other people, what it can do for you. And that's what we want to be able to provide. Then we focus on the advocacy and access to services. So getting, working on benefits, getting driver's license, all the things needed to go towards supportive housing. And then of course, our biggest goal of housing. So stabilization beds might be kind of a newer term that folks have heard of. I think, you know, everyone I hope has heard of Safe Haven. Stabilization beds are low threshold beds for high functioning street homeless individuals. And they're referred to these beds, you know, folks that can care for themselves. Case management is provided in tandem with outreach, as well as the on-site case managers that we have. And then we have stabilization beds throughout the 5 boroughs and are staffed by security and operations 24/7. So this picture is our opening day with our monument gear on. We really liked it. And unfortunately, our program director, Erica Vargas, couldn't be here, but I wanted to give you kind of our management team. We have Erica Vargas as the program director. Our assistant program director is Will Estevez that oversees operations. Our building super is Henry Martinez, and he oversees 2 other sites as well around the area. West 140th and Corner House, also in the Upper West Side. And then our case manager supervisor, Siobhan Towns. So the monument capacity, we have 200 beds, 64 are for females, 136 are for males, 7 floors, 2 recreation areas now fitted with TVs, which we have the Knicks game on right now, I'm hearing, and then spacious backyard patio, which I took a picture of this morning. It's a mix of doubles and single rooms. We have security on site 24/7. We have a residential and maintenance team as well, and case management. The security team, just to kind of focus on the security team. So there's rounds happening throughout the building at all times. It's every half hour. 1/2 hour, it's the security team going out and doing rounds, including the outside area. So the way that they kind of loop around the building, they'll do all of the floors and then go outside to kind of see what's happening in the neighborhood and then come back inside to report back. Our residential team stays within the building and are doing floors and also going into rooms, checking in with people. So how do folks get to us? So outreach teams and other service providers refer to DHS, called the Joint Command Center. And they are the ones that tell us where there are vacancies throughout the boroughs. And then they'll send the referrals over to our teams. We'll say, yes, good fit, or we'll kind of ask some questions, maybe to the outreach team or to the JCC. If everyone's in agreement, the person will come to us within anywhere, it's 72 hours usually that they arrive. Sometimes it's within the hour, which we're very happy to accommodate. And they are moved inside, they complete intake with our team, and they are able to go into their bed. One of the things that is really great about the monument is because of our continuity of care, because we are the outreach provider in this area, we do have, folks being directly referred from the Upper West Side and Upper East Side as well. And so for right now, for example, so we're partners of the Manhattan Outreach Consortium, which is the city-funded agency that provides outreach in Manhattan street level. And we have 59 clients from MOC as of last Friday. And 11 are from the Uptown Goddard team. When we first opened up to stabilization bed, we were able to get 3 pretty exciting clients to the monument that hadn't been inside for 30+ years within the Upper West Side. And we were really happy to have them come inside. It was the first time where, all they had asked for is, we want a bed in the Upper West Side. And we were able to provide that, which was a really exciting thing. Folks are staying inside and doing pretty well. Let's see. So the services, residential services. So we have rooms available, recreation area, and on-site laundry facilities. Our meals are provided by the Migrant Kitchen Initiative. And we also run groups and recreation activities. And as you can see, there's a little flyer there. Game nights are a big thing on Saturday nights with the teams, and the clients are always asking for more of them. So we're trying to do that. But we also want to do other types of groups like wellness and things like that. So we're going to infuse a few other things. The case management teams are focused on individualized living plans. So what is the goal of this person? What do they want? How can we help them with it? And all the steps that are needed to get to permanent housing. And so some of these, for some people, it could be really quick to permanent housing. And then for other people, it can kind of go around in different ways. And we always want to start with what the goals are of the client, because that's how we get that building trust and that relationship to kind of move towards that permanent housing with folks. Permanent housing also looks very different in many different ways. So it could be supportive housing where there's on-site case management, which Goddard Riverside has multiple supportive housing residences that fit that. We're also doing a lot of voucher work. So City FHEPS is a big voucher that we're looking into and applying for folks. And then always my favorite is family reunification. So when someone stabilizes and comes inside, they're, ready to reach out to family, get connected again, and potentially form a relationship and even move back to some family. We also do referrals. We are connected with Ryan Health for medical and mental health care, and we also will refer for substance use. We're always kind of looking for as many kind of referrals as possible, whatever the client's looking for to meet their needs. We are hiring up too. So what's exciting is we're also going to be adding on a harm reduction specialist that's going to work with more clinically complex clients that have maybe comorbid diagnoses of mental health and substance use, or pretty, maybe more substance use. We'll also have a registered nurse there working with clients to assist in medical stability. and a clinical social worker that'll be able to provide some on-site mental health care. And look at that. Any questions? I also wanted to provide, because I remember last March, you guys were asking for some phone numbers to reach out to us. And so we have the phone number listed there for the main number in case you have any questions or concerns.
Where's,
It's located in the Upper West Side. It's a couple streets down from here.
but where is?
We're located at, on West 95th.
What's the Broadway?
Between West End and,
And Jeannie, I'm already familiar with a lot of this, but for everyone else here, could you share a bit about what the transition to book stabilization status means?
sure, so, everyone's coming in kind of different ways, you know, to our site. So some people might have, you know, a couple of years of homelessness, maybe a few weeks of homelessness, or many, many years. And so stabilization, you know, being stabilized can look very different. So whether it's getting connected with mental health care or just, you know, a bed to sleep in for a couple of days and then starting to work with a case manager. That's kind of what we're talking about when we're speaking of stabilization, that the person's kind of ready to begin the work on finding that permanent housing for themselves. Does that answer your question?
And how does it differ from Safe Haven?
So we have, clients are able to care for themselves more independently than at Safe Haven. Safe Havens, they might need a little more assistance. Mhm.
And is there a time limit when they
No
have
time,
to leave?
yeah, no time limit. Really, it's when they get permanent housing. And so we usually, I don't know, Julie, do we still say the 9 to 24 months? It really depends on the person's journey.
With any client, right, they're individuals, right? So some clients come in and they've been, as she said, homeless for a short period of time, have all their documents and are ready, what we call low hanging fruit, right? Those clients can move much more expeditiously, right? They can get a housing package. They may not have severe mental health. They may have gone through a period. Some of them are already connected to maybe a substance abuse problem or have employment. And so they're, you know, they already have a benefit in place. So you're not starting at the very basic remedial level. So we normally, you don't get many that move out in the first 6 months because it takes a while. But they changed the voucher process now. So after, you only have to be homeless 1 day in order to get a voucher, where before you had to be in safe haven or stabilization 90 days to get the voucher. So to make it easier for people to move expeditiously, they changed a lot of things within the system, which were impediments to people. You know, so doing the individual approach works. And then you have the, you know, clients that have been homeless for much longer, right? And just even for them to share who they are in terms of their identity can take 9 to 12 months before they feel, you know, some people come in and all they provide to us is Joe. Joe doesn't share his last name, so we put him in as Joe X to create a temporary housing application. And then it might take the next 6 to 9 months to get him to open up to share his real identity. So each person individualized transition plans.
Can I have,
And I'm sorry, I didn't introduce Julie Harrison, Assistant Commissioner from DHS.
I'm Jamar Hooks, Deputy Commissioner for Intergovernmental Legislative Affairs at DSS. And just to add additional context, the clients are faced with the 1.4% vacancy rate for traditional permanent housing. So in addition to everything that Julie has described, they have to contend with everybody else who's looking for apartments at an affordable level. So it could take quite some time to find affordable housing. There's also supportive housing, which many of them are eligible for. That's not immediate either. It takes a couple of months to get the paperwork together and to get them moving.
So do you take everybody, or are there certain people who have problems that you may not want to be in your mix?
We accept, so to put context on outreach teams and stakeholders in the community can send us a referral through the Joint Crisis Command Center, right? Sometimes people are actually known to us Other times individuals are not known. The people who would probably be exempted from getting a stabilization placement would be somebody that's under supervision with parole, or mainly a sexual offense with a minor, right? So we wouldn't place somebody in community that had that kind of history, right? Where the school is co-located, but we don't discriminate for other, criminal backgrounds as a whole.
And is the voucher only good for the 5 boroughs, or do they use it?
They can use it up
Somewhere
Westchester County. Now that has expanded the voucher. You can go to Yonkers, you can go upstate, for soda, we have something for soda. So you can get, your rent paid for a year in another state. If you have someplace, some family member, somebody that's willing to receive you, you can go on to soda after that year. You just have to make sure you are able to pay the ongoing rent.
Yes, all 5 boroughs, but some boroughs are more expensive than others. The vouchers have value, so I have to live within their means, but that's why we've expanded it, as Julie said, to upstate as well, so that they can have opportunities to move in the more affordable places.
Is it only single people, like, is it couples that are come, or is it?
Oh, into the monument?
Into the monument.
We don't have rooms designed for couples, so what we have done in some instances, people couple up, but even after they get with us. Because it's 64 female, right? And if that happens, because we are a part of the single adult system, we cannot move couples. Couples need to go through the Adult Family Intake Center and develop domestic partnership. So we let them know that even if they come and, they find a boyfriend or girlfriend, I've had situations and say getting a stabilization where they actually got married and be like, well, we're married. And I'm like, oh, that's a very nice thing. And we applaud that and we want that for you if that's what you want. But we can't service you in our system because you need a family placement and we don't do family placement. So.
Any other questions? From folks in the committee?
Is this tied into section 8, section 9, when they get out to be able to afford a place?
Well, the city perhaps is that. City perhaps is sort of like a section 8 voucher, right? We have administration now where HUD, which is, provides a lot of the section 8 vouchers, is not doing that kind of rapid funding that we actually need in New York City for people to get the level of affordable housing, right? And the difference with a federal HUD voucher, set for section 8, it's portable. You can take it anywhere. City perhaps is just within the shelter in the city of New York and parts of Lower Westchester. So that's the difference, but if they choose to apply and they get lucky and they go and apply for section 8, they can use that as well.
And then
We also do the housing lottery too.
Yeah,
That is always a great one when one of our clients gets a housing lottery apartment.
And do you help people with
Mhm.
that?
Absolutely.
yeah.
And then section 9 is public housing, right?
Right.
They have it's not a simple process, but they have the option of getting into section 9 housing as well.
Nothing is off the table.
Yeah.
Anything that anybody would be eligible in the general public, we try to present it, right? The concern is that we want people, we get them in and we want stability, right? But we know that everybody may not be able to manage in the type of housing. So where we can, we try to steer those that need more support to supportive housing, right? Ones who are more independent and can live independently in community and may not need, a visiting nurse service or, a case manager on site. We'll triage to the voucher program.
Can someone come to you on their own?
We have people, here's the thing. I work in a certain office building and we have people that are outside every day and they're unsheltered and we see them, right? So we send teams outside to engage with those people who may not be known to outreach. And we will provide a bed to them as well, because at the end of the day, we're looking for people that are unsheltered and we know in any community, right? We don't want that individual to become the testimony of no help, right? We want to be able to say we offered help, you know, sometimes it'll take hundreds of engagements to get somebody to consider to come inside, right? So, you know, the city has done, different things in my tenure, right? We have pictures now, every building inside, so we can, when we're out on the street, we can share with somebody that says, well, what does the monument have? We can say, well, here's a photo of the room, this is what the bathroom looks like, this is what the outside of the building, you know, so even before people come on the referral sheet that we get from outreach is their demographics, there's questions about whether or not they're on medication, whether they have substance abuse, whether they have benefits, you know, and they tell us most referrals have a borough preference, right? People that are in Staten Island don't necessarily want to take the ferry and come over here to 95th Street, right? So, you know, people who pretty much live in the catchment or, you know, in Manhattan are okay with having a Manhattan placement. They don't want to go to the Bronx. So all of that is before anyone arrives at the front door, the monument is established. So we minimize on people getting to the front door and saying, nah, I thought I was going to Brooklyn. So we ask them their preferences.
So along with that, if I know someone in this situation that would seem to fit, I can make a call for them.
You can call the 311, which is the best way to go. To say there's an unsheltered person, you know, give a description, and they will dispatch the outreach team to the location to engage. You know, because you know, you know, people will say oftentimes it happens to us. You know, like I said, a gentleman outside my building, you know, he doesn't want service. He said, "Thank you, but I will take a meal." So you give him a meal, a hot dog, or whatever juice from the truck, and you tell him, you know what, I'm gonna check back in on him. Hopefully, by the end of the week, he might be more receptive or may take all month, next month, you know.
Do all the residents of the monument have to come through JCC, or can some of them come directly to you?
They come directly from the JCC.
That's not my question. My question is, can they come directly to you?
No, they have to go through the JCC.
Because we have to create what we call, the city requires that anybody entering a brick and mortar site have a temporary housing application, right? That, you know, identifies them as being unsheltered and, you know, creates that little one pager so they can get a number. We have to create a CARES number. CARES is the system of record. So if you disappear for 6 months and you come back, we still have you in the system.
Any other questions?
I just want to say I'm so happy you're here tonight and to share this with us directly. And with all the information we need. So that's, thank you.
Very helpful. Yeah.
Thank you, guys.
Thank you.
Thank you so much.
Thank you so much.
Next on the agenda. Our
Thank you.
presentation from our community planning fellow. Give folks a moment. Polly Zhu, I believe is online. Her panel. Okay, some of you may remember Polly Zhu as our, I hope I'm saying that right, is our community planning fellow. She's a graduate of Columbia, and came to us, late last year, middle of last year, with a wonderful ambition, and we're so excited to hear all of the good work that she's been able to do, putting together a list of and surveying all the resources that are available here. Big thanks before Polly gets started to Sarah Lee Kent for getting her started, and to Shelley for shepherding her through. All right, Polly, take it away.
Hi everyone, can you hear me well?
Yes.
Thank you so much for having me. Let me try to share my screen. I also prepare a little slide deck here. Okay. Is it working? Sorry, can you see my presentation? Yes?
Yes, we can see it. Yeah.
Okay, sounds cool.
I think they're having some.
Okay, then I'll get started. So, good evening, fellow community members and members of the Health and Human Services Committee. My name is Polly, and I've been having the privilege of serving as a community planning fellow through Fund for the City of New York in collaboration with our community board for the past few months. My background is in civic service design from Parsons School of Design, and my goal today is to share a little bit about what I've learned so far while working alongside our community to address some of the unique challenges of our district. The project takes on a service design perspective, which is grounded in the lived experiences and qualitative data of the neighbors we serve. So, as we know, our community has a standout demographic profile. Over 22% of all households in the district are headed by someone 65 or older. Among those, 59% are living alone. That means 6 in 10 older adults in CB7 live by themselves. And over 43% of them are paying more than 30% of their income on housing. So when we began, the goal was to have a comprehensive resource guide to fill in an information gap. However, some early research revealed that our district has no shortage of guides, directories, and services, yet still many eligible residents remain disconnected, and especially among the older adults living alone. This project, as a result, is going to investigate what stands between them and the access. So I want to first ground this in who we're talking about here. These are residents who may be living on fixed social security income in one of the most expensive neighborhoods in the country. When they try to call for a service, the automated phone menu maybe moving too fast. And when they finally reach a person, sometimes the operator can be lack of patience. And many would receive targeted phishing emails mimicking their bank, and there's no one at home to warn them against those scams. Their children may live far away, or they may never have any children. Either way, there's not always somebody checking in on them. And as mobility declines, the world will get smaller, increasingly secluded at home, difficult to get out. One frontline director described a woman they offered a donated worker to. It never came out of the package. This lady has fallen and been hospitalized for so many times and has a neurological condition that causes blindness and falls. But still, she insisted not to use the walker because she said that it's what old ladies use. So as we see, this is not a population defined by deficit. These are people with distinguished careers and fierce independence. What they share is isolation, declining mobility, and a deep reluctance to be seen as someone who needs help. The district has a rich service landscape on two fronts. On one side is the formal public benefits, which requires documentation, eligibility screening, interviews, and sometimes appeals. Those processes can be lengthy, opaque, and discouraging. You can see on the bottom left that is a journey map I made of one documented SNAP application with the social worker that I interviewed. With her full support throughout, it took from October to March. The case was closed twice after missed hearings with no fixed call time, and the outcome was benefits of $24 per month. And then I wanted to acknowledge that this is something that at a community board level might be a little bit hesitant or like limited in terms of intervention, but I wanted to flag this bureaucratic difficulty here. And on the other hand, we have the community-based programs where older adult centers with affordable meals and on-site social workers, neighborhood nonprofits with volunteer visits and peer groups, faith institutions and libraries, which is serving as informal information hubs. These tend to be low or no intake barriers requested and are built around social connections. So as we see, the services exist on both fronts. The central question then becomes whether eligible residents are reaching them actually. So then turns to the information aspect of it. And we know that actually information also exists between Gail Brewer's guide and Senator Holman Siegel's digital newsletters. We're not lacking information, but unstable nonprofit funding means service offerings would shift constantly. So compiled information would become quickly outdated, which I want to flag it here, makes it by nature hard to maintain. And many older adults are not even aware that these guides or platforms exist. And many older adults, 75 plus, are largely offline or do not trust digital interfaces. So in this sense, the information is out there, is often outdated, and delivered through channels much of this population doesn't use or know about. So then how does connection actually happen when it works? In every successful case I encountered across fieldwork and interviews, it traced back to a relationship already embedded in their day-to-day life. For example, and by the way, all the 4 examples I listed here come from real interviews. So a security guard at a local market could noticed an isolated 93-year-old man and mentioned a men's launch group. And then the old man later signed up. And then there's a neighborhood pharmacy that knows a senior's medication history and cross-referenced them, cross-referred them to a community nonprofit. A volunteer then started to visit them weekly. And then older adult coming to a senior center for lunch learned that the social worker service on site had resumed, and then she booked a consultation accordingly. And finally, a volunteer on her regular weekly visit noticed that there are signs of cognitive decline in a 97-year-old. When she visits, specifically, she smelled gas in the hallway and noticed that she forgot to turn it off. And then the volunteer reported back to the organization, and then the staff member started to initiate care coordination. In each case, connection happened organically and often passively through relationships already embedded in daily life. In a sense, a beloved local shop or physical referral can be a better transmitter than a centralized platform. But then what about those who aren't connected to any of these relational pathways? The most isolated residents may have no node in their daily life that could serve as a referral. They're not subscribed to organizational newsletters, and they may not know that resource guides or platforms exist. In the ideal scenario, they could call an elected official's office for guidance, but they may never actually make the call. So here I want to refer to research by scholars Bones and Flynn, who asked the question we often fail to consider: why didn't someone just ask? Their studies demonstrate that people in a position to provide help systematically underestimate the role that embarrassment plays in whether someone asks at all. Potential helpers overestimate the likelihood that people will reach out, and they misjudge the most effective outreach, emphasizing the practical benefits of seeking help rather than addressing help seekers' feelings of discomfort. Existing tools such as directories, guides, hotlines serve an important function for those who are actively seeking, but they do not address the first mile for those who are unlikely to ask in the first place. And so here I want to introduce the concept I coined as the first mile. And a stakeholder on our own senior task force put it: if a senior gets to an older adult center or any service entry point, there are people who can direct them to the right help. The question is getting them there. Once someone reaches any provider, formal or informal, the system has a chance to start to function. But then the gap is everything before this first initial contact. For the most isolated residents, this first mile is undesigned, if not underdesigned, and left to the ones least equipped to walk it. The encouraging news is that our district already has models that bridge this gap. These are community organizations that lead with what I'd call soft entry, social engagement before service navigation or informational referral. Could be book clubs, lunch groups, walking programs, no intake forms, and need surface organically through relationships often over months. As one case manager described to me, and I wanted to share her words directly, People don't like to ask for help, so many of these women has been independent their whole lives. Professors, lawyers, musicians, artists, they didn't need help. And then as they get to know us, they become more comfortable to tell their story. And that's when we find out that this person needs a lot more help. The woman with memory problems is so good at hiding it that at first I didn't even think her issues were substantial, and they are. So for those who shy away from asking for help, trust appears to be a precondition for disclosure. This helps explain why information-first approaches have limited reach with this segment of the population. And these models have found a way to reverse that sequence despite maybe not having substantial funding or institutional recognition at the time being. And so as a result, I would like to propose 3 strategies for the board to consider. First, strengthening proactive outreach, increasing our presence in familiar physical spaces, and launching a community ambassador model that activates the latent capacity within our own residential buildings. The first 2 strategies are complementary. Strategy 1 is based on the fact that we need to let go of the expectation that isolated residents will seek out information on their own, scaling the existing practice of some council members and service providers who are conducting proactive outreach directly in residential buildings, bringing benefit information to where people already live. And strategy 2 redistributes existing service information one-pagers to locations embedded in essential daily routines, such as grocery stores, pharmacies, laundromats, pet services, prioritizing hard copy over digital. I'm encouraged that our senior task force has already affirmed this approach as a priority for implementation. And the principle connecting both strategies being, if the first mile won't be walked by the residents, it must be walked by the system into their buildings and into the spaces they already visit. The third strategy is in the longer term, yet more structural and the most rooted in empowerment. Rather than designing another program delivered to older adults, it aims to activate the capacity within their own community. Essentially, we're encouraging interested older adults to become hosts in their own residential buildings, as many of the current volunteers at older adult support organizations are already older adults themselves. Potentially converting their living rooms into spaces for low barrier social gatherings like tea time, book clubs, or even mahjong. They would become the bridge across the first mile for their neighbors. This addresses 3 challenges simultaneously: zero distance mobility, no one has to leave the building; doorstep connection, peer relationships form at the threshold of home; and the trust to access pathway, because consistent social presence creates the conditions for real needs to surface across time. The support structure is critical. Local service organizations, potentially those based on trust-first models, already doing this type of work in the district, could sponsor and train hosts, support facilitation, supply printed materials, and establish referral pathways. This also means increasing funding and institutional support for these existing organizations, enabling them to share their skills, experience, and infrastructure with more local providers and new ambassador hosts. This is not a service delivered to older adults. It is community infrastructure led by the community itself. Lastly, I want to close with a reflection on certain limitations. This research could not access the most disconnected older adults in the district, which is a well-documented constraint in aging research in general, and itself suggestive of the very gap this project describes. An NYU sociologist and also an expert in aging research shared with me in an interview, we know less about populations who are less likely to be in the system, and that's part of the problem. The barriers documented in this project around stigma, the psychology of not asking, the undesigned first mile are not unique to older adults. These findings may hold relevance for any population facing shame and isolation in accessing public services. The people most in need are often invisible to existing systems, precisely because those systems require them to be visible first. Whether it is for older adults in our district or any neighbor facing isolation, the first mile cannot be left to the person least equipped to walk it. and we must build trust before we can offer access. Thank you for the opportunity to serve this community. Thank you.
Great job, Polly.
Thank you.
Thanks, Molly.
She didn't do it.
So Polly and I discussed that Sean
Okay.
Crew has started a program where he takes his staff and they go into buildings in his district. And they arrange with whoever's in charge of the building to, it's a great model, to go into the building and say, we can help you with staff benefits, we can help you with tree and street. We can get, we can tell you what senior center is nearby, we can tell you what other programs.
Are these Norks?
Hmm?
Are these Norks?
No,
Buildings?
there are any buildings in the neighborhood.
But how can you do that in a private building?
Right.
Come out of their apartments.
Well, he's doing it mostly he's northern of us, so he's doing it mostly in buildings where there's a landlord or it's a Newark or it's a Mitchell-Lama. But any building can apply. So if I lived in a building and there were a lot of seniors in my building and I was in his district, I could go to management and say, I'd like to have Sean come and to meet either in a community room or someone's apartment.
So the idea is that you do want the building to invite them first.
They're invited in, they're not
That's just-
marching in, saying we're here.
That's right.
Good.
That makes sense.
I've seen Anvita has her hand raised.
And she spread the word.
I think you just answered my question, Roberta. I was gonna ask about building size. So what's the difference between buildings that have fewer than like 20 resident or 24 residents and ones that have more? Because how do you kind of invite people to come in and kind of reach out and stuff? But I think you answered my question. I guess the other question I had was about language. So you mentioned having hard copy flyers. I was curious, in our district, is there a question, is there an issue of like language outreach of people not necessarily speaking English? I need to have multiple language and language translators. Would that come up in the research at all?
Yes, so during my field visit into different older adult centers, I did notice that there are existing like language accommodation in place already. And then I guess also the privilege of me also speaking Mandarin, so I had the chance to speak with both like English speakers and then a few people from the Chinese community. And then there's an interesting difference in terms of their access to social services, and then maybe their I guess access to also familiar like support from their families, but mainly because of like the cultural aspect of it. But then I think like in with regard to like language is also like critical in terms of when we are distributing those existing one pagers. Yeah, like it's definitely essential to have like multi-language covered there. Yes.
Last year, the senior task force had looked at all the guides that different electives have done, and they're very extensive and they're mostly online. And we asked Brad Hoylman, who was then the state senator, to do a one pager with specific information. I think I sent that around to everybody a while ago. That a senior could use, or your family could use, or somebody in the building could use. And what Polly has done is said, that's great that we sent it around, but a lot of seniors didn't get it. So she came up with the idea of putting it in the supermarket, the bodega, the shoemaker, wherever a senior might go normally could see the flyer.
Yeah. The thing is that outside of the city, a lot of supermarkets and places like that have bulletin boards.
Right.
And where people put up, need dog walker and other kinds of things. We don't have that in the city. I don't know where
City.
in Zabos they would put something.
Food City on Columbus Avenue still has that.
Do they?
Yeah.
It's unlikely that an isolated senior citizen would be shopping at Zabar's or any of the boutique kind of places. I mean, they don't come out of their apartments, it sounds
I
like.
have a friend who
There's a lot of
I
older
have a
people in
friend
Zabos.
who is
Older people, yes. but
has dementia. And she's married to a very loving husband who's clueless. And he's let her go out by herself. And she's fallen and had some problems. And so one of the groups we work with is Visiting Nurse, so I got the pamphlet from Visiting Nurse that they will come in. It's not very expensive. They'll come into the house and do things, but I happen to know these people and I happen to know the husband. If it was somebody else, where I didn't know the husband, I don't know that I would be that presumptuous.
I really like the idea of the last mile, what you said.
Yeah.
The Polly's
Polly's idea.
Polly's idea, first
First
mile,
mile.
not last mile, hopefully not the last mile, first mile, forgive me. But what you just said made me think about that, because you are able to bridge that first mile, because you can be, as you said, presumptuous. But, and if I understood Polly's presentation to be like, we can't be assuming that people will reach out if they need help, right? That is not going to work. So we sort of have to be presumptuous on a personal level and on a policy level, to be like putting the foot in the door, hopefully not too literally, but maybe literally. I was wondering, just mailing, if we could mail some guides. I know that there's obviously a budget for the electeds and they like to send those. But it certainly would help if they, if we could make a push or a request for electeds to include a one pager, or you tell me more about that.
So I met with, after Polly did this, it made me think about, we can't go out as individuals and go to buildings and knock on doors, but it made me think about what we could be doing. So I met with people from Brad's office and we've come up with a few plans of things of, when they do their mailings, to target it to seniors, figure out, through, they have spreadsheets, they have, data that they can get, and when they do a mailing, to target it to, but also if it came to my children that maybe mom needs some help,
Right.
and also it made me think not only about seniors, but there may be people that are 25 to 50 that don't know that some services are available for them.
Sure.
So I think one of our jobs will be to convince our elected officials to do kind of what Sean's doing. Because he's the only one I know of that's doing that.
Doesn't Gail send out a list of phone numbers?
Yes, but.
Yeah, who to
if I'm
call in
sitting-
case of.
if I'm- So my friend who has dementia, her husband's not reading this and not reaching out to Gail.
What about already existing organizations like Dear Road?
Yeah,
Which is
that's
always trying to reach out to seniors.
Right.
They have-
Sorry, I wanted to add a little bit, because I know a lot of the emphasis so far has been on, how to get the information more proactively to people's doorstep, basically. But I guess a second essence or core of this finding is also the trust piece over there. I guess maybe because there's one example or anecdote I just heard during one interview, was not included in this presentation, but basically there was an older man who were enduring a health condition for many years or maybe decades, until after continuous months of participation in a men's lunch group or a book club, that somebody on that in that group encouraged him consistently and persistently to get a surgery done. And there's available benefits that could maybe cut the price and everything. It wouldn't cost him a lot and everything. And then he finally got encouraged to get it done. And then eventually he felt like he started to sing again or play guitar again, and felt like life has never been so much better. So that was one story I heard during the interview that also really just testify to the fact that how trust is, because thinking about how people, when they're searching for help, they're in a is extremely vulnerable situation, and then it's kind of idealized scene or picture to think that people would, when they get having a discomfort or a challenge in life, they would just, without any kind of overthinking or any kind of emotional burden or those kind of complicated elements. Just, pick up the phone and make the right call to the person according to, the right directory, and then ask like, oh, can I get this help and that help? I feel like it's an over idealized situation, even though it would be nice if that's the case. There's also the like human emotional aspect that's deeply interwoven, with regard to, being in that kind of disadvantage or vulnerable situation. And it's not, and often the case, like always not that easy and straightforward for somebody to like just reach out that way. So that's why I also propose the third strategy out there, even though I also know that it's gonna cost a lot and it's gonna, take a long time actually for it to actualize. But I still want to put the vision there at least and see, if any forms of it or parts of it could be actualized, because that's the one that's really targeting that trust piece that really requires time and it's organically growing and time for it to grow. So yeah, I guess I just wanted to share and highlight this aspect of my findings as well.
Thank you.
I also told Polly, the beginning of the pandemic, my building, which has over 500 apartments, sent out an email to everybody in the building saying that there was a small group of people that were technically, like, had technical backgrounds, and that they would be willing to help anybody with any technical issues. And then there was another group that was willing to go to the store and pick up anything for people that felt they were compromised and couldn't go. And that was just within one building, but if we can replicate or get the electeds or get some organization. Polly's gonna come to the senior task force in May. Good.
Good.
So Madge was saying something about Duro. They have a wonderful program that
Yeah, they were here last-
hooks up a young person in college, young person with an isolated senior, and they visit every week or every other week, and they develop a relationship with that person. I know it's very labor intensive, but it seems like a wonderful kind of a program, and then they can get people to come and to avail themselves of service.
I know someone on the board who has tech help from there. They come to her house and give her
Right.
tech help, which is great. And they also, I sort of don't want to ignore them, that they've been doing this, what you're talking about, for so many years.
50 years.
Mhm.
But there are other organizations.
And other ones too. There
Sorry,
are.
we did comment.
Okay, I'm Angeli. I moved back to the Upper West Side 2 years ago from physician, so I just wanted to get involved. So comment about this, every building has a superintendent, right? So I don't know if there's a way to reach out to all the superintendents, because they'll know who's isolated or who might need attention. So that might be a good way. I don't know if there is a community of, like, is there a WhatsApp, or like, do you guys have like a list of all the supers, or does that even
No.
exist?
Wow.
But they would be the
I
ones
don't
that
think
would
that's
That's a
know.
very good idea.
Nandita has her hand up.
Yeah,
Very good
I
suggestion.
think this depends on the building, to be honest. So in certain buildings, like the super doesn't always live in the building. You have a super that's shared across buildings, and their job primarily is just maintenance. It's not necessarily like they might not necessarily know who the tenants are. They just know if there's a maintenance request to kind of go and fix it. So I don't know if cooperation with supers is necessarily great, but I think it might be a different approach for different size of buildings, right? If like you have a building with a doorman, right? That's going to be a different experience than, someone where you have a super across multiple buildings. And I've had different experiences different places. Um, so it might work for certain size buildings, but I don't know that across the board you can rely on supers to know who the tenants are, know who needs access, and actually take the time to advocate for them, if that makes sense.
Yeah.
I mean,
Well, that's not.
And they're so
necessarily-
And there's
busy.
some organizations,
Or just identify, right?
like Goddard Riverside is very good about doing outreach to all their neighboring buildings. So they kind of know where all the seniors are, and even if they haven't gotten them, but they're a small catchment area.
Yeah.
So this area is not part of their catchment area. They don't have the human being power to, they'd love to be there. But they, with the staff and the money they have, they can only be here.
But I think you have to to do mix and match, right? Like, I think Polly's message is you need to have human contact, right? It's the person in the
So that's something
store.
we can do, but that's something we can encourage
Right.
our electeds and we can certainly encourage our electeds and our local organizations to do.
Right. But there's an organization called Lily,
Yes.
Living in Later Years.
Right.
And it's basically above 110th Street. And they're rather remarkable. And they have all kinds of activities from book clubs and movie nights and walking. Holly, did you talk to them? Because some of the
Yes,
activities,
she did.
Yes, actually, the model I mentioned there is based on Lily. Like Lily was one of the biggest inspiration in this research.
yeah, because then they go all the way to arrange for technical help from students from Columbia, taking people to doctors. So it goes from social interaction to assistance.
Wasn't it started in
And then you
one
have
group?
search and care,
in
and you
one
have
group of
churches and
buildings.
synagogues. When you think about what's available on the Upper West Side, we have an abundance of wonderful services and wonderful organizations. And when Polly and I were talking, we were both, people in my building may not know about these services, and unless they have a friend on the floor, that, there are 10 apartments on my floor. I know everyone on my floor, and everyone on my floor knows each other, but there are floors in my building where people don't talk to each other, they don't know each other. So there could be a senior on another.
A lot
floor.
of this is word of mouth, and the thing is, how do you encourage
But
word of
that's
mouth?
what's.
And that's one of the reasons I like Lily. It's actually a huge organization.
Is it in one very particular area where there's a huge middle income kind of development that's been there for years and years? It's right above near Columbia. Morningside
Yes.
Heights, is it?
No, no,
Morningside
no, no,
Gardens.
Gardens.
Morningside
That's
Gardens.
CV9. So
Yeah,
But some buildings become more
but we
friendly.
could model.
There's also Bloomingdale Aging in Place.
Oh,
Yeah.
great organization.
Yep.
And they have a lot of programs and activities.
I have a unique perspective on this because I was working with Polly back in the fall when the idea was initially to develop a kind of a consumer guide to the services available in our district. And that, as she found out, we kind of suspected that, particularly for seniors, that's kind of oversaturated. So you've really taken this in a very interesting and useful direction. I just wanted to compliment you but, in a way, I mean, what we really need, we're kind of trying to put Band-Aids on something on a dysfunctional system, kind of a non-system. What we really need is a country where when somebody turns 65, they get a visit from a social worker, and everybody does, and then you get check-ins like every year. After that, and that's part of the public health system.
Good luck.
But we have basically no
Here
public
now, we
health.
just-
You can move to Sweden.
What?
We just support you here.
Yeah, now we just support you. We have money for that. Lots of money. for that.
We are at 7:30, so it's an hour, which makes us a little over the agenda. As much as I would love to have get a response and hear more responses about that point. I think we should at this point say thank you to Polly.
Thank you so much.
Thank you.
Yeah,
I think
thank you. And feel free to reach out to me if there's any further questions or comments or feedback. I would love to hear them and see if this project can take for me any forms of implementation or actualization. I would love to see that.
Thank you.
What's her email?
we could share Polly's email.
Yeah, within YouTube.
We'll share her email over.
Yeah, perfect. Next on the agenda is me, a presentation about air pollution, which is scheduled for 10 minutes. I'll try and make it the 10 minutes. We pushed this from last month, so I'll just go ahead and do it. And just to give you a sense about why I'm talking about this, why I think this matters for our health department. Obviously, some of you may know that I got sort of turned on to the issue of air pollution through the Citizens Air Complaint Program, which is how the city has this innovative program that allows citizens to report violations of our city's idling laws, which have been on the books since 1971, but went completely unenforced by city agencies until citizens were able to actually, given a mechanism by the de Blasio administration to, report that. And after some, hiccups during COVID, it's actually really taken off, that it's the single biggest source of air pollution enforcement. Well, that got me interested in what is the deal with all this air pollution. And it turns out, I hate to say, that we suffer from an epidemic of air pollution. Physicians who are here may know this, but it really is a terrible burden. So I just wanted everyone to think about it, because once your eyes get opened, it is hard to have them closed again. So I'm just going to focus on one of the single biggest sources of pollution, the one that is pretty well studied, and we understand a little bit about what it does, but people may not have heard about it. It's called PM 2.5. That is a particular kind of particulate matter that is smaller than 2.5 microns. And this illustration that I found on the internet shows you that sand, which is the really, really fine sand that can give you silicosis, is about 90 microns. Pollen is 10 microns, and PM 2.5 by definition is smaller than that. Why does that matter? Well, tailpipe emissions are rife with PM 2.5. And so you get diesel and gasoline exhaust. It affects the body not only through PM 2.5, but through carbon dioxide, carbon monoxide, nitrous oxide, ozone, nitrogen compounds, things like that. But decades of research have established that PM 2.5 is especially dangerous. Scientific studies show, we always think about the lungs when we think about air pollution, but PM 2.5 it's so tiny that it gets into every tissue in the body. You breathe it in, and then it goes into your brain. It affects heart and lung function. It worsens cardiovascular and brain functions. There's a study that shows that just 1 minute of diesel inhalation can knock your IQ down by 5 points. Just sitting next to diesel makes you dumber. Fortunately, that impact is on a short-term basis, but then in terms of the long-term exposure to fine particulates, PM 2.5 causes increased mortality from heart disease and may be associated with increased rates of chronic bronchitis, reduced lung function, and lung cancer. And then, of course, people with heart and breathing problems, pregnant women, children, and older adults may be particularly sensitive to particulate pollution. So the New York NYC Health has done a study and shows that there's premature mortality and people 30 and above, that there's 3,200 instances of premature mortality. What does that mean? People who died earlier than they otherwise would have because of just PM 2.5 levels. So if we reduced it by 10%, you could save 350 lives per year. We also see, as we're talking about the Health and Human Services Committee, hospital admissions for respiratory conditions caused by PM 2.5 alone are estimated to be 1,200 in the city. For your cardiovascular conditions, an additional hospital admissions about 920, ER visits 2,400, ER visits for asthma 3,600 per year, just caused by PM 2.5. And it obviously is like many things in our society, is not equally distributed. So what we see from the Union of Concerned Scientists had a report that shows that in New York, in particular, Asian Americans, people of Latin or Hispanic descent, and African Americans are exposed to higher levels of PM 2.5 from cars, trucks, and buses than our white New Yorkers, which is really unfortunate. But is a legacy of our built environment where people who have less money live closer to sources of pollution. Focusing, however, on the Upper West Side, not known in many cases for its environmental, or sorry, I should say economic disadvantages. It does have some areas, they're called environmental justice areas. You can see those are sort of highlighted in blue down on in the western portion of our district, of our community district. And then you can see, up here where, the top of our district, there are environmental justice areas. And that is a designation that the city, sorry, the state has made, as to places.
In those two areas where there are public schools, the asthma rates in the children are much higher than other public schools.
Absolutely, absolutely. And so I was gonna say, those are areas that are designated by, I believe it's by the state as disadvantaged communities. It's a function of a number of different factors, and I wouldn't be able to tell you all of them, but they do include, things like air pollution. So this I got from the, EJ NYC Data, Explorer. I'm not good enough to figure out how to change the colors to make them bright and all that. But again, just focusing on PM 2.5, we see that there are, areas of the city that are, especially, if you compare it with Jersey, which has nothing on this map, we see that there are some especially dark areas, central Harlem and down here in Lincoln Square, mid-level areas, are shown in gray. And it actually, what that tells us is that the Upper West Side has some of the dirtiest air in the city. And most importantly, we are obviously adjacent to Midtown Manhattan, which has the dirtiest air in the city. Pretty much everywhere in CD7 has PM 2.5 levels that are at or above average for the rest of the city. And so just to focus on one particular census tract, unsurprisingly, the part of our district near Midtown, nearest Midtown, has the highest levels of PM 2.5 pollution. We're in the 89th percentile down there in Lincoln Square, of, a 7, what is that, mu? How do you say it? It is micrograms per cubic meter. I knew the Greek letter, but I wasn't 100% sure whether it was micrograms. There you go. So just to go back and forth, you can see that area that I highlighted is some of the darkest. It's 89th percentile, and we are all in 50th, 51st to 75th percentile throughout the Upper West Side.
And is that Central Park, is that a dark area or is that just the trees at
That's the
Central Park?
reservoir.
That's a
The
reservoir.
Well, sorry,
yes,
yeah, that is
reservoir.
that is the reservoir,
Thank
but
you,
but I believe on this map, it
That
is
would be
still
great.
in the 75th percentile. I could go live to that. I believe it's all in the 50th, 51st to 75th
Yeah.
percentile.
But why is, there are quite wealthy areas that are dark, like the Upper East Side, the area around Lincoln Square there.
Yep.
Roosevelt Island,
A lot of traffic.
Yeah, it's traffic.
So we are heavily burdened by traffic. That is absolutely
That's
true.
how we
but
get.
then if we're talking about the Upper West Side, the West Side Highway, why isn't it that whole area
Cause it's right on the water.
between Riverside and Broadway going up?
Oh, I'm sorry. I believe that all of this area, if you see where my mouse is going there, all of this area is the same, it's in the same quartile. Because all of the Upper West Side is at or above average. I think it's only this little area here that might be below.
And where is
50th
that?
percentile. That's a great question, and I took a screenshot, and I can maybe try and go to
Is
the
that-
map.
That's too high for the museum.
Is that the
It's
museum?
like 90, or is it,
Yeah.
what are
Because it
what
seems
are those
like,
towers?
it looks like you would think that
It's the
that
traverse,
area
too.
would be affected by its neighboring buildings and neighboring traffic.
Yeah, so,
Well, maybe it's that area that doesn't have traffic going through it, Park West Village. where
I think that
there-
is-
I think that's
it's
what it is.
Without any
That's
traffic.
what it is.
exactly what it is.
Uh-huh.
It's Park West Village. You're right.
Yeah.
That's where we are.
Maybe
That's saying something, isn't it? It doesn't have traffic going through it. It's particulate matter is gonna be lower.
Yeah, but you'd have to
Is
stay
there
there the whole
suggestion about
time. If you don't
Well-
leave your block, you're still gonna get.
Well,
It was
all
good to
right.
be isolated there.
Yeah.
So obviously, so I'm just gonna see, here's this last slide,
Is it-
about the problem. This is a data set from 2005 and 2007. And what we see is that the west side, is a little bit better than the rest of town. But our decrease has been pretty substantial since, in the last 20 years. And you can compare it to the rest of the city, how unfortunately, you can see that there are much bigger areas of the city that are in much better shape. Midtown is the worst, downtown Brooklyn is the worst, Upper Manhattan still suffering a lot, as is the Bronx, especially around the GW Bridge. We're fortunately here in the middle, in the Upper West Side, we are not doing as badly as the rest of it. And so I think that basically shows that the congestion pattern, is what maps onto, the pollution. If there's more congestion, you're gonna get more pollution. Here's my personal, sign of progress. On the left-hand side is that same map we had before, where you saw the EJ areas, in the top and bottom of our districts here. And this is on the right, a map of the, idling complaints that citizens have submitted. It goes through basically April of last year, so the data lags about a year behind. But the red dots, each one of those red dots is one complaint. And if it's in a red, it's a red complaint, it's in an EJ area. If it's in a blue complaint, it's in a non-EJ area. And you'll see that as compared to the
What's EJ?
environmental justice, or it's also called the disadvantaged community, they're essentially the same thing as far as I'm aware.
But I'm confused about why Park West Village, which is right next to Amsterdam houses, how could it be, not Amsterdam, not Douglas houses, how could it be so different? They're right next to each other.
In terms of the PM 2.5 air pollution, you're saying? That's a great question. We should look at that. I don't know the answer to that. I do know that if you see, there's, in terms of the roadway, there's a lot less of a roadway, in both of those areas.
Yes, because I was gonna say Douglas houses has areas with no road going through it either.
Exactly. Yeah. It's a great
Not
question.
as large.
I think the density's got to be greater too in Douglas.
The
House, too.
density's greater, but the grid is not as wide.
That's right. I think if you look on the left-hand side here, you can see there is a inroad here between Manhattan Avenue and Central Park West that is not there for Central.
And if you look at the other white grid that's lower, on the left, by the river.
Oh, yeah.
Much lower down. Right above Limit Square, that's probably Lincoln Towers. And that's also a big grid.
So I'll leave it with this because we're at
Doesn't make
time
sense.
here, more overtime. When I say signs of progress, I mean, I can see on an individual basis that that trucks and buses are aware that there is a lot more enforcement of the idle laws. So for instance, today, at least a half dozen, really more closer to a dozen trucks and buses operators, when they saw there was truly out there on the prowl, we're happy to shut off and, stop idling. They wouldn't have done it if we didn't have citizen enforcement. So that is I'll get off my soapbox, and if you have any questions, let me know. But
What did you do when you saw an island truck?
what one can do is you can record on your phone a video showing them idling for more than 3 minutes anywhere in the city of New York, or 1 minute when you're on a block that is adjacent to a school or a park. And you can submit that to the DEP. The DEP is the agency charged with reviewing citizen complaints. They're currently about 11 and a half months behind, unfortunately, but that eventually will get to a company with a violation. If they go to hearing, then that hearing takes another 8 to 10 months.
Okay, but there's nothing where you actually go and talk to the truck driver and he turns it off so that we have an immediate result.
I personally have talked to a number of truck drivers, but the issue really is more systemic and bigger than that. You want the companies are the ones who pay the fines, and so the individual truck drivers, may or may not listen to you or may tell you to, go pound sand. But the companies are the ones who are going to get the fine, get the violation, pay the fine, and hopefully modify their behavior. There's been a lot of
Amazon.
I personally know that an Amazon contractor that used to pollute all up and down Broadway called Merchants Fleet has turned off. They still double park, still take up our public space. But overnight in June of 2023, they turned off because they finally got sick of paying the fines. And now Amazon, if you see an Amazon on the Upper West Side polluting, please let me know, because I would be very surprised. Some of the other big companies still have yet to learn their lesson.
We
Unfortunately.
don't call 311.
Say it again.
We don't call 311.
You can call 311 if you want, but there will be absolutely zero impact. Now, don't get me wrong. DEP does keep track of the 311 complaints, and that, goes into a report, which then they cite, and I don't think anyone pays attention to it. But if you record it on your phone, submit it to the DEP through the DEP website. I'm happy to help anyone who wants to get started. Eventually the process will, result in a fine to the company.
We put that up on our website under HHS committee.
Sure, I'd love to do that.
But you should point out that of that fine, you get a cut.
That is true. That is true,
Really?
which is a major incentive
There
for
are some
people
people,
to pay attention to it.
when I was co-chair of the Parks and Environment Committee before the pandemic, we had a presentation from the grandfather of this thing called a guy named George Pakenham, who did a film called, what was it called?
Well,
It'll come to me.
he did several of them, but Idle Threats is one
Idle
of them.
Threat was the name.
Yeah.
I knew Shelley was fishing.
This is something that older
And
people
some
can do.
people,
and make
some
money.
people,
100%.
some people have made, I mean.
Have a purpose in their
$10,000
walking.
Really?
Excellent.
You make 25% of the fine that is actually paid, and so the first level fine is $350, which works out to 25% of that is $87.50. It goes up if it's a second violation, it's $440. If it's a third violation, it's $600, and so.
Really?
That's right. And it does take about 2 years for you to see any money. So I don't wanna, overpromise, but in all seriousness about like the impact on health, on air pollution, it is a tough thing to study. I would love to figure out a way to like isolate it from a study perspective, but on an anecdotal level and on a company level, we can look at the data to show that certain companies do absolutely take this economic incentive and do something different. So for instance, school buses and the upper end of our community district have started to run they run electric school buses, which, is perfect because obviously our most vulnerable population are seniors and children. And the people who are on the buses are our children, and they don't deserve to have diesel pumped into their lungs, just like the seniors who are walking by on the street.
So my son traded in his 12-year-old Jeep
Oh,
for an all-electric.
okay.
So
I hear there are these
He's
things called
helping.
e-bikes also.
They could do
Oh,
school
okay.
projects.
That's true. I hear that as well.
And I hear they don't pollute. I don't know.
I think that's right. I think that's right. So thanks so much. I don't know if we have any new business.
Motion to adjourn.
Hearing none.
second.
Okay. All in favor?
Aye.
All right. Thanks so much, everybody.
Thank you, everyone.
Thank you.
Everyone.